Hi, I'm Dr. Michael Miyazaki, and I'm really excited to be here today. I've got Garrett Caldwell again, CEO of Core Dental Laboratory and the Pacific Aesthetic Continuum, or we call it the PAC. And our guest today is Tanya Dunlap, PhD. And Tanya knows a great amount, and so I'm kind of really eager to pick her brain. But she is the VP, Vice President of Perio Protect. Perio Protect, just in case you haven't used them, I know it's hard to see because I got it blurred, but they're these little trays that you put some hydrogen peroxide in. Garrett, you need some of these. You'll wake up, you won't have morning breath, you'll have better gum health, and you'll have whiter teeth.
Well,
So that's what
I
Perio
sleep
Protect.
with my dog, Mike, so
Yeah. So your dog will
my
appreciate these
dog will
trays.
appreciate me.
That's right. But don't leave them out because the dog will love these as a chew toy, I believe. So just kind of be careful.
Completely. Yes.
Yeah. But Tanya's been the vice president of Paraprotect. She started there back in 2005. So
Not as the vice president, but yeah, I've been working there for 20 years almost now.
20 years. So see, this is tried and true. And she served as a research liaison working with microbiologists, principal investigators, statisticians, and consultants. So this is a home treatment that is well steeped in research. And she also, and I had the pleasure of working with Tanya in a couple of programs where she actually teaches and trains KOLs. So those are the key opinion leaders of how to teach others of our colleagues about the power of the ParaProtect trays. And she teaches courses to other clinicians and both to dentists, hygienists. We've had assistants there, really front desk. The whole team needs to understand the importance of this. And she shows us the clinical and the financial implications and the research data. And so I thought it'd be really cool to have Tanya on for today. So Tanya, welcome. Garrett, welcome.
Thank you.
Thanks, Mike. Welcome, Tanya.
Thank you. I'm so happy to be here with you both.
So the part that I told Tanya that I really like is the story. Like, how did the Paraprotect trays come about?
It is a great story. It's personal because my family is involved, but also there's a lot of accidents that happen along the way. And sometimes really good science results from accidents, things you don't expect. So my father was a dentist. He trained in perio. He ended up doing general dentistry and focusing on a lot of patients in chronic pain for TMJ dysfunction. But one of those patients was his mother, and she ended up, as many Americans do, right? Like by the time we're over 65, 70% of us have lost bone already. So it was that she was at that age and she had lost some bone and she needed perio surgery. So she went out and got a quad of surgery and came back and he said, "You look great. We're ready to do the next one." She said, "Oh, no, we're not ready. I'm not doing it. Find another way. I would rather lose my teeth than do this again." Now, this is back in the day when it was, there weren't a lot of options as we have now. But that began the quest. She said, "I'll try anything you recommend and I'll let you know how it goes, but we have to find a different way to do this." And to be clear, you can't always avoid surgery. So I'll put that out there. But in his case, he was trying all kinds of things. So, we're classically trained biofilm based infection. Biofilm wasn't even a thing at the time. So we'll call it a bacterial based infection. You work with antibiotics. So he took syringes and he pushed the antibiotics deep in the pocket. It all flowed back out. And so he came up with a variety of delivery you know, vehicles. And the one that worked for some of his patients really well was tufted floss. So every 2 or 3 inches on the floss, there'd be this big tufted thing, and he soaked it in tetracycline. And he had patients who used it, and it was pretty effective for them. It was super messy, right? You can imagine you're flossing, and there's tetracycline going all over the wherever you are. Um, and it went to controlled clinical trials, and it totally fell flat. And so he thought, okay, I got to come up with a way that is not technique sensitive, that is super easy, and that is comfortable for patients. And so he ended up playing around with tray designs. Now your regular vacuum form tray leaks really badly, and so that wasn't working. Mouth guards are really bulky, and the whitening trays didn't have enough. So he ended up finally designing a tray that has an internal peripheral seal. So that tray reliably delivers the medication really deep. So let's focus on the medication for a moment. He was still using antibiotics in the tray, but he was also recommending a hydrogen peroxide gel, primarily as a propulsion agent, to get that medication, the antibiotic, deep in the periodontal pocket. He was getting great results. And so one day this patient comes in And he was submitting things to FDA for the delivery of the tray and everything else because you got to get FDA clearance to take things to market. And one day a patient walks in and she says, after he had told her, you look terrific, keep it up. She said, do I need that liquid medication anymore? And he's like, well, the liquid was the antibiotic. How long have you not had it? She said, probably 6 months. And he's like, huh, well, we'll put you back on it. But he started to think it wasn't the antibiotic that was doing it. It was the hydrogen peroxide that was doing it. So that led him back to a literature review. And that lit review took him to Bill Costerton. Bill Costerton was a microbiologist out of Canada, and he was working at Montana at the time. And Bill says, well, I got some office hours. You want to come and see me? So Dwayne flies out the next week and they sit down and he starts to figure out it is the hydrogen peroxide that is doing all the work. So, to make it long story short, we started working more with hydrogen peroxide and less with antibiotics. And there are times when we still recommend an antibiotic, but not for its antibacterial properties. We recommend it because it actually stabilizes bone. In the
Wow.
tetracycline class of drugs, the drug will inhibit osteoclasts and boost osteoblasts. So we we do value all of this science basis, and we do have detailed versions for people who want more education. But our basic program focuses on the peroxide, and the advanced program now focuses on the antibiotic.
Yeah. No, I love that story. And it's always the post-it notes, right?
That's right. Yeah.
It's like the post-it note story. So Garrett, now you know why you need your trays. You got to grow more bone.
Well, you're
Actually, like
you're my doctor, Mike. You need to tell me. I don't know.
our number one reason that we actually prescribe it is just to get rid of all the bleeding and inflammation, right? That chronic inflammation. So when you have bleeding sites, and we have a gum score. The gum score, your best gum score is a 0, right? 0 bleeding points. But you want a score that's under 10. If it's over 10, over 100, you're really concerned, especially if you have type 2 diabetes or a high blood pressure or something like that. And our goal there is to say, look, you have a high gum score and we're concerned. Let's say they have type 2 diabetes, because if you let this chronic infection go, it's much harder to manage your blood sugar, or you increase your risk for heart attack or stroke. Or there's research that actually shows that the bacteria leaving your gums can lodge in an artery and cause arterial inflammation. These are things that we're very concerned about for you.
If I had to practice, let's say 1,000 patients,
Yeah.
how many of those patients in a typical practice are going to be candidates for using Perio Protect, the Perio Tray?
80, yeah, clearly 80%.
80%.
Yeah, so you're talking about everybody with gingivitis, right? Over 10 bleeding points, for example. Anyone with restorative work is a great candidate because you get those chronic infections around your crown margins or your implant crown margins, and it threatens the life of your restorative work. If you want optimal restorations, you definitely want Perio Protect. Anyone who's got bone loss, right? So by the time we're 65, that's 70% of us. Even by the time we're 30, even young adults, half of us have bone loss. So there's a huge patient population there. And then anyone who's even, let's say you're an orthodontist, you finish an ortho case. What happens typically after that? You've got 4s and 5s in the posterior of your molars. You've got some gingival infection around the rims, right? Clean it up. Put it in after every case, and you will have gorgeous gums, but also white teeth that you've newly aligned, which everyone will appreciate. And the whitening is super soft and gentle because it's a low concentration of peroxide, 1.7%.
That's what I was going
Um,
to ask you, Tanya.
yeah,
Is this a tray and a product
it
combination
is.
in
It's
a
a
gel
tray and a
form?
product. So there are other drugs you put in the tray, which, the whole antibiotic story, but also remineralizing agents go in the tray. If you have lichen planus, you can put in some analgesics as well as some topical steroids. That's a whole protocol that a periodontist at University of Oklahoma created. But the primary antimicrobial is this, what we call Periogel, 1.7% hydrogen peroxide. So your lowest whitening agent is 10% carbamide peroxide. This
Mhm.
equates to half of that, 5% carbamide peroxide. The white teeth are awesome unless you have like one veneer on number 8, right?
Yeah.
That's going to cause a problem. But for most people, they love the white teeth.
And they are really comfortable. You with the trays, just put a little bit of the hydrogen peroxide gel on there, you pop the tray on for 10, 15 minutes and you're done. And when you put it in and you get used to how much you actually have to put in, you kind of forget that they're there. And so the other day I was getting ready for bed, put my gel in there. I don't know, making the bed, getting it all ready, and almost jumped into bed instead of my trays in. So then I had to
Yeah.
remember, now I got to get out of bed, rinse them out, let them dry, and then I mean they're really comfortable. So no, it's nice to have that.
It is nice. We want them to fit like a glove. I was just in a meeting and our return rate is less than 1%. It's actually like a half of 1%. So we're very proud of that. And it helps with people scanning, as you can imagine.
Yeah. So two things. I want to go into the antibiotic story a little bit more because a lot of us think, oh, there's an infection, antibiotics are the thing to use. But really quick, you mentioned something in the introduction. You mentioned the tray and the way that it fits so tightly around the tissue because some doctors will look at this and think, well, I can just make a suck down, right? What's the difference between a bleach tray versus a Perio tray? So can you just clarify that one more time? I
Yeah,
know
sure.
it's
So, yeah, I went over it really fast in the event. So, just a regular vacuum form tray, especially if it's a bleach tray, it's designed to prevent the medication from getting any contact to the gingiva. This tray has an extension that's going to go past your gingival margin by several millimeters. And on the internal peripheral side of that, there is a seal. And where we place that seal and how we make it, that's what really matters. The seal and the extension, it works like a gasket and it prevents the medication from leaking out. So if you're going to take any kind of a product, especially one that delivers a drug to market, you have to have clearance from the FDA before you can make claims. And those claims are often also based in your research. So this is what makes Perio Protect such a great product for any dentist. All the work has been done for you already, and it's a pretty easy process to get started. You take a quick course at less than an hour, and we will show you all the patient candidates who can benefit. We'll explain to your teams, my friend, um, why the peroxide works well and who it's good for. There really are no contraindications except for that case when you have a veneer or a child, right, that has too many changes in their dentition. But otherwise, it's super easy. We have lots of done for you programs to get started as well.
So, Mike, one thing you mentioned, whitening at night. Can this tray be used with other manufacturers' products,
I wouldn't use
whitening products?
anything else that's a high concentration of peroxide because it burns the tissue.
Okay.
Yeah, it causes, it would be super uncomfortable. Now, the tray itself fits really precisely. You should not be able to easily dislodge this with your tongue. And it does have almost a suction effect to it. But as Mike said, it's super comfortable. It is
yeah.
really, really comfortable. I also often forget I have them in. I, sometimes watch TV and when I watch, I binge. I don't like just casually watch. So, and I'm lazy. I don't get up in after, you only need to wear them 15 minutes max. 10 is good, 15 is ideal. If you go longer, it doesn't help you. The hydrogen peroxide is broken down to oxygen and water right at 10 minutes, 17 minutes. So it doesn't help you. It doesn't hurt you. It's just, it's convenient.
I don't know if it's politically correct to say, but are you a cat lady?
No, I just happen to be working from home and this cat is insistent on being
First the
here.
cat was on your right, the cat's on your left.
Yeah.
Is it just
Well,
one
it's because
cat?
I'm pushing her down like this out of the screen and she decided she's going to come up another way. I should have closed the door.
Yeah, no, it's good. We like to have pets. Everyone's welcome to these interviews.
We get more
You have
views when
dogs
we have
barking or
cats.
cats jumping. It's one or the other,
Yeah,
right?
Mike, we should add cats to our podcast because we
yeah,
would get more views.
yeah, we should. There's millions of them around that probably are interested in what we have to say.
Exactly.
And Garrett, going back to the manufacturer, and then we'll jump back into the science part of this. But before the Paratrays, like we've been using them for years, and you used to take your impressions and send it to lab, and it would take you weeks to get these back. So that was kind of a drawback. Dentist patients, we just hate waiting for the crown or whatever to be back in the office. But Tanya, how fast do you turn these around today?
We're turning them fast within 2 days, and then we set them FedEx in 2 days. So you'll have them within a week.
Okay.
See, Garrett, the
If you
lab.
send it with a scan, right? If
Yeah.
you mail it in, then it's a totally different thing. You got to
Yeah.
have the front end mail time.
Let's go back into the science because I know one of the best parts of your presentation, everything's really good, but one of the best parts is always that antibiotic story. So, we
Yes.
sit there and I know you've got all the details, but we as dentists, oh, you've got nacre pain. Here's maybe a pain med and here's some antibiotics. And we just
Yeah.
give those antibiotics kind of out like candy, but you know that we shouldn't be doing that. So what's the story behind the antibiotics?
So let's have some fun. Dentists write a lot of scripts. You guys are the number 3 prescribers outpatient in the country. The first Most common scripts or the most numerous scripts come from your primary care physicians, and then from nurse practitioners, and then dentists are the number three prescribers. You want to guess how many scripts dentists write a year? Go really high. It's over 10 million. There's what? I don't know, 200,000. Can we say there's 200,000 dentists in the US?
Yeah.
What do you think?
Yeah.
Yeah. Okay. Dentists write 25 million scripts a year, according to the ADA and the CDC. 25 million. That's only 10% of all the scripts that are written. So we're writing, this was pre-COVID. We wrote 250 million scripts a year. After, not after, in the middle of COVID, we were down to 211 million scripts a year, but dentists were still high. Your offices were closed. You had to still write scripts. It's, this is difficult.
Mike, are you writing 90 scripts per year? I mean, pardon me, per month?
Yeah.
That's some fast math, right?
Yeah,
Very nice.
90, that's about what it is. It's like 1,000
Yeah.
a year. That's a
It's a
lot.
lot. It's a lot.
Yeah.
So some patients know that they're supposed to have it, right? Like those with prosthetic joints, they were told 9 years ago that they always need to be pre-medicated. But even though those guidelines have changed, they know it. So there's a lot of pressure. But the fact of the matter is, it's really hard to treat a biofilm-based infection with an antibiotic. And I'll just make this premise. If antibiotics were going to work well for periodontal disease, we would have seen it already. We have been using them for decades, and we have super high rates of disease. And there's a lot of reasons why antibiotics don't work well against a biofilm-based disease. So a biofilm is that community of bacteria that's covered and closed in a matrix, which is basically a gooey layer of slime. It's really hard for an antibiotic to penetrate through the slime. And even if it did, then a lot of the cells that are within the actual community are not actively dividing. They're dormant. They're alive, but they're not actively dividing. And so traditional antibiotics are going to work only as those cells actively divide. And then you got to find the right drug for the right combination of bacteria, which in the human mouth, you got a lot of variety of bugs. So it's hard to find the right bacteria, the right antibiotic in any event. Plus, you get a cell that develops a resistance to an antibiotic, and it can teach that resistance to other cells. So now there are whole classes well, I should say there's at least 18 different species that I've identified in casual research that are completely resistant to all antibiotics now. This is scary stuff.
Hmm.
And so having a non-antibiotic option is very important. Besides that, it's a heck of a lot more effective.
So what about patients that are gargling regularly with 3% hydrogen peroxide?
Yeah, they may end up with black hairy tongue. So when you gargle, a rinse, your toothbrush, floss, whatever it is, it doesn't get deep enough. And this is why you need the tray to deliver that medication deep and hold it there long enough to work. So with peroxide, you need time. So those folks who are gargling, I don't know how long they're gargling, but if they're really doing it for the right amount of time, they're going to have an overkill of healthy bacteria in their mouth too, and they may end up with a fungus that looks like black hair growing on their tongue. It's not dangerous; it's just unsightly. You can use a nystatin rinse. It's not, there's solutions for it, but you don't need all of that antimicrobial action. And for gum disease, we really want to target it deep into the pockets where the bacteria have this like safe harbor.
Yeah, that's really cool. So antibiotics don't work. The trays work better. The trays are easy to get. The trays are comfortable. Um, what are some of the other benefits to the patient?
It is so important to look at patients' health histories. So, in general, what you can expect with Perio Protect is a huge reduction in bleeding and probing and inflammation. So, we say in the first 2 weeks, at least 50%. So, if you're bleeding at 168 sites, we should get you well below 80 even. But we want to get you down to zero. If we can't get you to zero, we should be able to get you to single digits. So huge reduction in bleeding and inflammation. And this is in combination always with what you do in the office. So I want to be clear, this is prescription home care. Whatever you're doing in the office, it doesn't really change that. You add this in order to help your patients maintain the gains you got and actually improve on them between office visits. So the huge reductions in bleeding, unprobing, and inflammation, an additional significant reduction in pocket probing depth scores, optimal restorative results, whiter teeth, which most people really love. It takes about 4 weeks to see that because it's a low concentration, but the fresh breath is very fast. That those people you can smell before you can see, even them, first week, wipe it out. Huge quality of life improvement right there. In terms of the office workflow, there are also benefits because when patients are healthier between office visit, your maintenance appointments, or your even if they're prophy, they're so fast and easy. They're comfortable for the patient because what's uncomfortable is the swollen tissue, right? So super comfortable. I think your anybody who's doing implants, it's like a no-brainer. Just throw a set of Perio trays in there, right? It's a low-cost way to make sure the tissue around the implant stays healthy. Because once that starts to get infected, it's a harder treatment plan. And then productivity. So think about all the patients in your practice who can benefit from this, from gingivitis to perio to perio maintenance to your restorative cases, implants. Um, are the fees actually quite reasonable to dental practices, and most offices are making at least $500 a case. So if you go through there and you think about what you can do, we have practices that add single practices, somewhere between 5 and 10,000 a month, just, and I'm talking profit, not revenue, with this. So there's so many benefits, and on the financial side, it's just because you can help so many patients. It really is great work for your patients.
So Tanya, you just were reading my mind.
Oh yeah.
So we're jumped from the chemistry to the business side because Mike and I
Yeah.
are trying to always, we talk about implants and we talk about ortho and we talk about doing resin bonded dentistry and some of the techniques that are a little more difficult to just deliver immediately
Right.
versus something like this where a doctor can incorporate it into their hygiene program and see initial revenue returns.
Yeah.
So yeah, my question was, what is the average cost for the dental business to deliver
Mhm.
this to the patient? What is the average return per patient?
Yeah. So we recommend people charge around 3 times their lab fee, simply because it really doesn't require much doctor time. It's almost all team driven, right? The doc needs to know and the doc needs to confirm that it's the right choice for the patient moving forward. That's kind of a no-brainer when you see chronic infection. Especially, I didn't go back. Let me go back to this because you asked it earlier, Dr. Mike. What if your patient has type 2 diabetes, right? It seems pretty far removed from your mouth, but we teach all of these talking points, and they don't have to be complicated, but they're true. If you have chronic periodontal inflammation, it's much harder for you to maintain proper blood sugar, right? It is. If you have high blood pressure and you have gum disease, that gum disease is a chronic low grade burden on your immune system, right? And if your immune system is like a battery, there's only so many things, challenges it can handle, but we can get your gums healthier. Let's unplug that from your immune system. We put this into the context. If you already have cardiovascular disease, you're at a higher risk for stroke or heart attack. If you have chronic periodontal infection, the numbers are clear. So putting that in there, this just means that it is important for so many patients. Number one, to know they have disease. Like the most important thing you can do on the dental team is diagnose disease. So doctors' roles come into there. Doctor needs to help, diagnose and confirm that diagnosis. But beyond that, doc does very little. 3 times your lab fee, it's somewhere around $750. And that includes 3 tubes of gel, the shipping, all of it. And some offices are higher. Like I know Perio offices that are charging $1,200 for a set. Some are lower, but that's where we recommend it.
And the cost for the doctor, I'm sorry, Tanya, so the
Yeah. It's
delivery
roughly
costs
two.
are 700 to 1,200 for the patient side on the retail side.
Your cost is two. We start at 250, but the more trays you do, the more volume you do, the better your price gets.
Okay.
And if you're in a small group, everybody's grouped together. The more you do, the better your pricing gets.
So the hygiene department can do the equivalent of the doctor delivering one aesthetic case per month, right there.
Yes, that's right.
Yeah.
Mhm.
Yeah, it is a great way to boost your production out of hygiene for sure.
So like Garrett, what we're talking about is if you have a patient comes in and they want, let's say, veneers, but they haven't been to the dentist for a while or their hygiene's not very good, so they've got the bloody gums. Well, we don't want to prep into bloody gums. So what you do is you start them on the perio trays first, get the gums all healthy, and then that'd make the case management much easier from that point on. And then once you did your aesthetic case like veneers, you could have another set of trays made if you needed to so the patient can maintain the health of the tissue around that aesthetic work, plus keep the teeth whiter. So it's kind of a win-win-win for everyone.
Yeah, no, I can see that. We deal with, post at the seat of an anterior aesthetic case, you're always dealing with the concern of bleeding and
That's right.
corrupting the margin and getting those
Yeah.
little black spots on the margins. And that anytime we can have healthier tissue when we're bonding, it's always better.
And if you use those trays before you place the veneers, you'll have a very clear understanding of where your margin is, and it's not going to move around on you. And then if you need a set of trays afterwards, after for whatever reason, it's cheap. It's like $150 total for a second set. And whenever that happens, trays typically last a really long time. I say 5 to 8 years, but I know patients who've been in trays for 10.
So maybe if you have micro leakage, Mike, maybe there won't be.
Yeah,
Maybe
I
if
know.
you do these trays post-op, if you have a little bit of micro leakage, you won't see any black.
That's right. That's the idea.
Honestly,
Absolutely. And they're a delivery device. So like Tanya was mentioning before, you could put a remineralization type of product in there so that you don't have to worry about recurrent decay around your margins as much, cut down sensitivity. So there's a lot of different uses for these trays and because it can be so cost effective if you're placing implants in your patients, you might give them a set of trays just to keep the implants healthy because we know that's kind of the weak point, that perimucositis and the periimplantitis. And if we can keep that tissue healthier, then you kind of ward all that away, which is something that's really good. Or if you get a patient, that tough case, they're starting to get some inflammation around an implant, then I like to move into perio trays just to kind of see if we can reverse that before we get into the periimplantitis stages. So it's got a lot of great uses and it's so easy to use. Maybe we could talk about that. The great thing about it is integration wise, it doesn't really disrupt your workflow, Garrett. It's just patient comes in, like Tanya's mentioned, a lot of times the hygienist will say, so and so, Mrs. Jones has inflammation of the gums, and it could be gingivitis or periodontitis. And a lot of times in our office, what we'll do is we'll say, Mrs. Jones, what we would like to do is we'd like to get this inflammation down because you have too much bleeding. That's not a good thing not only for your mouth, but for your entire body. And we've got an adjunct to treatment, and that would be the perio trays. But a lot of times, like let's say they have gingivitis and it's just a lot of bleeding, but not a lot of bone loss. We'll tell the patient, hey, our hygienist, Bobby spent some time with you, went through your home hygiene regimen. Do you think you can brush and floss? And of course, they say, yeah, I'll do that. Well, they come back 6 months later and nothing's gotten any better. So at that point, now it's like, well, Mrs. Jones, we gave it a shot. It's just not working, and we really want to control that inflammation because it's having a bad effect on the rest of your body too, not just your mouth and teeth. And so, it's a good time to just get them in the perio trays. And so, if that's something that our hygienist has seen, we've tried to do better home care, that's not working, then I'll come in and say, I'll confirm that, yeah, it hasn't gotten better, and I'll reconfirm the recommendation to go into a perio tray treatment. And what we'll do is our hygienist isn't really good at scanning, but my assistants are. So my assistant will bring the scanner over. One of my assistants will scan the mouth. That just goes to Peritray. And like Tanya's saying, in a week, we get the trays back. When the trays come back, the patient's usually scheduled for the delivery. We give them the instructions on how to use a tray, what not to do. Don't leave them in heat. We don't want them to warp or anything like that. We show them a video of how to use the trays, and we go through that with the patient. They try the trays in. And I usually don't even have to see the patient. My assistant will go through everything, answer all the questions, and then we let the patient go. And the patient will come back, usually at the next hygiene visit, and they'll bring the trays just so we can be sure that everything's, good with them, everything's working, it's comfortable, they don't have any questions. And so it is really easy, minimal amount of doctor time, but I think maximum amount of effect because if the patient just uses the trays and their home care doesn't really improve, they're going to have healthier gums. And so I think that's the important part is we're looking at trying to keep the cost reasonable to the patient, but it's almost invaluable, right? If they come and they spend, $1,000, let's say, for these trays, and they're healthier, and their blood pressure is better, and their blood sugar is better. I mean, that's kind of priceless. So, and I think the significant other waking up and there's no morning breath, that's priceless too. So,
So Tanya, I have a
Okay.
quick question to jump in before I forget. Two questions, actually. First question is, what if the doctor doesn't have a scanner and
Yeah.
is it impression based? No problem.
You can take an impression. Don't make sure you use plastic because throw it into CT scanner and we
Okay.
digitize everything.
You're
So
going to
this is a
digitize it. So you're going to scan it. Insurance supported, doctor prescribed. Yes or no?
yes, there are two insurance codes, one for the upper arch, one for the lower arch. Those four numbers are 5995 and 5996. However, they're not well covered.
Okay.
So
Delta Dental, for example. Can you talk a little bit about
Delta
that?
Dental, Delta PPO, to my knowledge, has never covered this. Delta Premier covers pretty well. If
Okay.
you are still grandfathered into Delta Premier, I mean, we're hearing $450 a tray in California. United Healthcare in California has done well, more recently.
Great.
And we work with the VA. So there are Blue Cross Blue Shield has a couple of plans out east that they do business as other names. They cover sometimes at 350 a tray, but usually patients' benefits are exhausted pretty quickly. So
So,
yeah,
Mike, you're an independent and of insurance. So now, if you have a patient that wants this Perio Tray, you can prescribe that, and they can get up to $450 of that, $750 to $1,200 covered back, which I think is fantastic.
Hmm.
And it's not always the case, especially with something that's a product like this that's potentially not recognized industry wide at this point. But do you see that expanding? Because we have a large percentage of our doctors, obviously, in this country still driven by, and I say unfortunately, but still hopefully not much longer insurance based, driven by insurance based or capitation. And so the patients are expecting everything's for free once I have dental insurance. So
Yeah, I think well, I think it goes back to the value statement that I think the cost relative, so if these trays are gonna last you 5 years, and let's say you do get some benefits from insurance and the trays 750 and you get 450 of it covered, that's $300. And if it lasts five
what a
years, it costs you
value. What
yeah,
a value.
$60 a year, right, for the from the
Yes.
patient side. So but it could mean that they live longer, so they might have to save more. But that
yeah,
they could have,
being able to get closer to the ones you love, right? Like you're those people who offend you by their smell, right? You
yeah,
know them. This is a huge quality of life improvement.
yeah.
I kind of have a rule, at least in my world, anything under $1,200 that can deliver this kind of benefit and the profitability for the practice when you're doing something great for the
Yeah.
patient and you have great revenue for the practice should be incorporated right away. We're always looking for how do we get new patients and how do I improve my marketing and how do I do all these things to create new business rather than working on the clients or the patients that we have now and doing a
That's
better
it.
job with those patients and creating those revenue opportunities and a great opportunity for the patient to be healthier and get better services from the practice. This fits right into that niche.
It's hard to understand how excited offices get when they see their first couple of patients come back because we show you in our training programs before and afters and what you can expect, but when it's your patient and this person's been coming in for years and they're struggling and they always have 40 to 50 bleeding points or whatever it is, and now we're down to like one or two. Sometimes, I mean, the stories are people jumping out of chairs, giving each other high fives, and it's such a good experience, and it builds a lot of trust with your patient base also. You can help so many people.
Great, great. So we need to get Tanya to come over to one of our study groups next year if she's in town. Tanya, where are you located?
I'm in St. Louis. That's where home is.
St. Louis, near Dr. Jack Griffin.
Mhm.
Yes, actually. Yeah, not far, about 25 minutes from him.
Do you know Jack?
I do. I know him.
Great
Yeah,
guy, great
he does a
guy. He
great
was just out teaching a program with us here. But
Okay.
oh, great. Well, we'll definitely have to have Mike include this in the lectures for the hands-on course and talk about this a little bit more next year in our
Yeah,
program.
hands-on. If you've got scanners, you could just incorporate all that or send your scans early and we can send trays and you guys can deliver them there and check them out. That would be fun.
I love it.
You're sold, huh?
I'm sold. I'm gonna get. I guess when I come by hygiene, my hygiene is gonna be now a little bit more expensive at Dr. Miyasaki's office because I'm gonna get a say. I think I only had 3 bleeding points last time though.
Yeah,
Oh, well, that's pretty good.
Unless
Yeah.
she's lying to, they might just be making me feel good though.
yeah, yeah.
Tell me, everything is all good.
But everything can always be better. Like Tanya's saying, we strive for zero.
Five for zero, yeah, for sure. I love the whitening benefits, and I love the whole concept of something that's, perio is just always a challenge. And, somebody who gets deep, gets scaling over and over and over and
You do
over again,
not want to repeat it.
this can prevent that mental anguish of going into the doc and having to say, hey, we're going to scale,
Yeah.
again and again. If this can help with that, I think it's right away, right there, patients are going to jump in on this.
Yeah, you know what patients are like though. They get that first scaling appointment and they think they're done, like for forever.
There
So
you
it's
go.
it is important to tell them we prescribe Perio Protect, and it is prescription home care, right? It's cleared by FDA as a prescription medical device. So we prescribe Perio Protect so that you won't have to do this and repeat it in the next 2 to 3 years. You don't want to promise them they're never going to have to do it, but honestly, a lot of people can't. They keep up with their maintenance. They don't need nearly as much repetitive scaling, if any, sometimes.
Well, the first time you get a chest pain, you
Yeah.
say, I wonder if I should go jogging right now. So the first time you get scaling, you're pretty much open to anything that means you
That's
might
right.
not have to come
That's
back
right.
again. So,
Yeah. I'm glad. No, I've had a great time talking with both of you today, and the cats. The cats were cute there. No, Tanya, just want to say thank you very much for your time and to go through the benefits of the Perio Protect protocols with the Perio trays. And I think they're minimally invasive. It's just a great way to keep our patients healthier. And so it's good for the patient. And on the practice side, we do get some revenue from the hygiene side of our practices, which is a good thing in today's economy. So it really is win-win and very affordable, as Garrett mentioned. Everybody should be implemented into their practices. And just think, if you had an average practice today is what, about 1,400 active patients, and if 80% of those needed to get into these trays,
Yeah.
and you were making $500 a tray, you're adding almost $750,000 of revenue to your practice, just by scanning and delivering the trays. And I think that's the important side from the business perspective. And Garrett and I have been trying to get the doctors to think about the business side of their practice, but as a clinician, we don't do it necessarily for the money. We do it for our patients' health and what's better for them. So I think you're both right. At today's fees, a set of trays is what, like maybe half a mouth of SRPs, and this is a lot more comfortable than that. And it's something that will keep your whole body healthier because, face it, those patients that get the SRPs usually don't have the best hygiene even after they've gone through that pleasant experience. So this is
Yeah.
just an easy way to help them avoid that again and to keep them healthy. So
Yeah. And we try to tell the patients, right, or teach the teams to tell the patients, look, we know you're trying at home. Your toothbrush can't get deep enough. It's not your fault. It really isn't their fault. They
yeah,
might not be flossing, but even if they had great technique, it's not going to go deeper than 3 millimeters.
yeah.
yeah.
So it's a way to like empathize with them and be there with them as they make these tough choices because it is emotionally charged.
Tanya, where's the best place for doctors to go first to look into this?
So periprotect.com/4u has just a ton of information, but you can also, once you get there, ask for somebody to reach out directly to you and you'll get full information.
Okay, great.
And Tanya brought up a good point that so the depth, because you're absolutely right. When I'm talking to patients and they've got gum disease, I tell them, "Are you brushing and flossing?" And they go, "Yeah, I'm brushing and flossing." I go, "Okay, even if you have the best technique, you're probably getting down 2 or 3 millimeters, but you've got this 5 or 6 millimeter pocket, and that's why these perio trays are so important because the perio tray will get the hydrogen gel. How deep?
9 millimeters.
Wow,
Yeah, 9.
wow.
But I mean, if you've got 9 millimeter pockets, you might have granulaminous tissue and it still would require some surgery, right? So it's home care, but it is great home care.
Yeah. So the potential's there. I mean, if we can get the hydrogen peroxide 9 millimeters, hopefully we're catching this earlier before we get that deep.
Exactly. Yeah.
But I mean, I think that's the benefit. You've got that patient just even with the 4 millimeter pocket, and a lot of our patients have those, and they brush and floss, and they're not getting down to that bottom of that four. So that bacteria is just colonizing down there, becoming that biofilm that we can't disrupt, and things just kind of start going south from that. And especially with a dental implant down there, now it gets even more difficult. So. What's the answer? Perio Trays.
It helps a lot of people.
Just want to say thank you again to Garrett. It's always good to have Garrett and Tanya. It's been great having you on this
Thank you
interview
both.
today, and
Yeah.
love the information. And I hope everybody looks into the Perio Protect protocols and implementing the Perio Trays. We've been doing it in our office, and as Tanya's saying, our patients love it, and our team, they all have their Perio Trays, and they all love it. So it makes it an easier way to serve our patients. All
Well,
right.
thank you, Tanya. Great information. Thank you so much for taking the time today.
Thank
Good
you
Yeah.
for
job.
your interest. I really
Thank
appreciate
Yeah.
you.
it. Okay.